We're finding that rheumatologists are really increasingly leading the charge in prescribing Benlysta and Lupkynis. They're also much more likely to use the brand name Lupkynis over generics like tacrolimus and cyclosporin. So why do you think rheumatologists are sort of more apt than nephrologists to adopt a brand name like Lupkynis over cheaper options like tacrolimus or cyclosporin?
Well, I think it's because in general, we haven't been using a lot of calcineurin inhibitors. We, as I've already said earlier, we were not enamored with cyclosporin,
Mhm.
and tacrolimus is used, but not commonly. So I think voclosporin, with the data we have,
Mhm.
is the reason that people want to use it. We know what we need to do with it. We know how to adjust for estimated GFR, and that's important. And actually, there's a lot of discussion about the fact that the PK is much more predictable with voclosporin than it is with the other CNIs, and I think that's an important point.
Okay. Dr. Radhakrishnan, any thoughts on the use of generics versus the brand name?
So, in the nephrology field, like Vibeke was saying, we've been very comfortable with CNIs because of transplant patients with primary
Right.
glomerular disease. So I personally have been using, CNIs for difficult to control lupus patients forever. But you're right, it's not, even then, it's not widely used amongst nephrologists with lupus nephritis patients. But the fact that we have now a, FDA approved therapy, which doesn't need levels, which is a big deal, right? Will hopefully change the landscape for more, wider use of this drug. The converse is true.